Good afternoon. We're going to talk about antenatal betamethasone for women at risk for late preterm delivery. My name is Nicole Macias, and so as we know, infants who are born at 34 to 6 weeks of gestation, let's say preterm, are at great risk for adverse respiratory and other outcomes that those born at 37 weeks of gestation or later. It is not known whether betamethasone administered to women at risk for late preterm delivery decreases that risk of neonatal morbidities. Methods: we conducted a multicenter randomized trial involving women with a single-tone pregnancy at 34 weeks, 0 weeks to 7 to 36 weeks, and 5 days of gestation who were at high risk for delivery during the late preterm period up to 36 weeks and 6 days. So the participants were assigned to receive 2 injections of betamethasone of matching or unmatching placebo for 24 hours apart. The primary outcome was a neonatal composite of the treatment in the first 72 hours. The use of continuous positive airway pressure or high flow nasal cannula for at least 2 hours, supplemental oxygen with a fraction of inspired oxygen at least 0.30 for at least 44 hours, extracorporeal membrane oxygenation or mechanical ventilation, or stillbirth and neonatal death within 72 hours of delivery. Here's the video. So next we have the results. The results for primary So now we have it. The results of the primary outcome occurred in 165 of 1,427 infants, let's say 11.6% in the betamethasone group, and 200 of 1,400, 14.4% in the placebo group. Severe respiratory complications, transient tachypnea of the newborn, surfactant use, and bronchopulmonary dysplasia also occurred in significant less frequently in the use of in the betamethasone group. So there were no significant between two group differences in the incidence of chronic amniotis or neonatal sepsis. Neonatal hypoglycemia was more common in the betamethasone group than in the placebo group. Conclusion: administration of betamethasone to women at risk for late preterm delivery significantly reduced the rate of neonatal respiratory complications.